Good morning, everyone. I'm Tomiko Brown-Nagin, Dean of the Harvard Radcliffe Institute, and it is my pleasure to welcome you to Radcliffe Day 2023. Now, this convening is always the highlight of our year. It is a time for us to bring all of the wonderful members of our community together to reflect upon and to celebrate Radcliffe's values of excellence, opportunity, and impact. And I want you to know that those values are deeply rooted in our proud history as Radcliffe College. And of course, on Radcliffe Day, we also recognize an individual whose life and work embody those values. Today, we honor the healthcare and social justice advocate, Ophelia Dahl. Ophelia is co-founder of Partners in Health, and we honor her for her lifelong work advancing global access to healthcare and defending the rights of the poor. I'm pleased that we'll start today's program with a testimonial from another remarkable woman, Chelsea Clinton, someone who knows Ophelia and her work very well. I'll introduce Chelsea in just a moment. After the testimonial, and in keeping with Radcliffe Day tradition, we'll hear from an expert panel grappling with an issue that's closely related to the honoree's life and work. Today, that's the essential role of women leaders in global health. After the panel, we'll break for lunch before returning for our afternoon activities, when Ophelia will engage in a keynote conversation with best-selling author and Partners in Health trustee, John Green. And of course, after their discussion, we'll conclude the day's festivities by formally awarding Ophelia the Radcliffe Medal. Now, it's a full program, so let's get started. I'm now very glad to introduce Chelsea Clinton. Chelsea is vice chair of the Clinton Foundation, where she works to improve the lives and inspire emerging leaders throughout the United States and around the globe. She also serves as vice chair of the Clinton Health Access Initiative, teaches at Columbia University's Mailman School of Public Health, and serves on the board of trustees of Partners in Health. A longtime public health advocate, Chelsea raises awareness about issues including childhood obesity, vaccine hesitancy, and health equity. She co-authored with Devi Sridhar the book Governing Global Health: Who Runs the World and Why. She's also the best-selling author of numerous books for young readers, including She Persisted: 13 American Women Who Changed the World. She's also co-authored 2 books with Hillary Rodham Clinton, a 2018 Radcliffe Medalist. Chelsea's also the co-founder of Hidden Light Productions. Thank you, Chelsea, so much for joining us today. And now I'll ask the audience to join me in welcoming Chelsea Clinton to the stage.
Good morning, everyone, and thank you, Dean Brown-Nagin, for that really warm and generous introduction. Thank you all for your patience and forbearance as I walked slowly across the stage. I am so happy to be here along with my boot. I feel as if we kind of are this inevitable package deal. I also want to thank everyone here at the Radcliffe Institute for not only the spectacular weather, and yes, you should take credit for that, but also having organized a number of events, I know what extraordinary energy and effort goes into ensuring that they appear effortless and easy. So just really, Dean, so much gratitude to you and to all of your team for welcoming us on this spectacularly beautiful day in such an easy, warm, and generous manner. And it really is such a pleasure for me to be here to help honor my friend and my mentor, Ophelia Dahl. It's also a real joy to be here with so many people in celebration of Ophelia, including many friends and colleagues from across the global health landscape and many of Ophelia's friends and family members. And so want to just say a special hello and thank you to the Dahl and Francis families for joining us today. Because as someone who knows a little bit about having family members who are dogged and tireless public servants over many decades, I know that work is only possible when it is done with full support and partnership and championship by our loved ones. And really, it is a joy to be here to share some thoughts and reflections for someone that I have been lucky enough to know for more than 15 years. I first met Ophelia through her work with Partners in Health after I had originally met her co-founder, Dr. Paul Farmer. And I remember almost 2 decades ago, after maybe 3 minutes of conversation with Paul at the Barcelona AIDS conference, he said, "You have to meet Ophelia." And I thought, well, yes, I do. Who's Ophelia? And he said, we would not be here without her. And I certainly suspect he never said anything more true. Ophelia, as I'm sure many of you know, met Paul when she was 18 years old. She'd left school in England and traveled to Haiti to volunteer at an eye care clinic. And there she met a young medical student, Paul Farmer. She also met the LaFontaine family and many others who would be part of coalescing the original partnership that would found Partners in Health. And what they may have lacked in resources, and as Paul would later acknowledge, also in medical education and expertise, they more than compensated for with imagination, moral purpose, indefatigability, and the deep belief that it was possible to provide a preferential option to the poor when it comes to healthcare delivery and public health infrastructure. And certainly in the 40 years since Partners in Health founding, Ophelia has been part of proving that every single day. Proving that it is possible to deliver good healthcare to people anywhere, that it is possible to push back against the legacy of exploitation and colonialism and slavery, to include and empower people to then be able to deliver that healthcare themselves, and that it is possible to build an institution that now operates across 4 continents, 11 countries, with 17,000 employees serving millions of patients and inspiring countless others to do the work of partnership and accompaniment in their own lives. It has been a real important, profoundly important part of my life to be able to learn with and to learn from and learn alongside Ophelia through our work together on the board of Partners in Health, as well as now on the board of the Clinton Health Access Initiative. Because Ophelia's life teaches us what is possible when a fierce intellect and an unbounded imagination are matched with a capacious heart and an unflinching purpose to advance global health equity. And also why it is so important that this work is not only the work of clinicians, that it is important to have people who know how to think strategically, to think with clear-eyed sensibilities when it comes to organizational capacity and capacity building, and who knows how to run stuff and get stuff done. And I think that is partly why Ophelia's leadership has been so inspiring to others who may not have gone to medical school or nursing school or be trained as a community healthcare worker or a birth attendant or a midwife, that we too have something to contribute to the work of global health equity. And yet, I know this makes it all sound as if she's an incredibly sober person, and she is a serious person. She also, though, is a warm person and a funny person, And I think that warmth and humor has been so important to helping her continue to always push forward. And while we are here on Radcliffe Day and in the broader Harvard ecosystem, and I know how important Radcliffe and Harvard have been to the work of Partners in Health, as I'm standing here, I would feel remiss if I didn't also acknowledge Ophelia's relationship to Wellesley, because my mother's a very proud Wellesley alum, as well as a proud Radcliffe Medal recipient from 2018. And I know that Ophelia's time at Wellesley, as well as her relationships here to the broader Radcliffe and Harvard community, have been so important to her life. And I think that it would be also awkward to stand here and not acknowledge the extraordinary call again to leadership that Ophelia faced after we lost our beloved Paul Farmer last February. When everyone, I think, who loved Paul, who had been mentored by Paul, who had kind of been in the warmth of his spirit and his collective call to all of us, kind of felt such enormous grief, it really fell to Ophelia to push forward through that grief to continue to edify the work of Partners in Health, to edify the work of the University of Global Health Equity, which meant so much to Paul and he believed was fundamental to the future of global health equity in Rwanda and for the world. And once again, Ophelia taught us so much about what it means to be a leader, that we don't only get to lead when it's easy, and we don't only get to lead when life turns out as we would hope it would be, but we often have to lead when it is hard, when it is ugly, when it is painful, and that is when we see the true spirit of leadership. And I think, too, that true spirit of leadership is seen in the echoes of the countless thousands who have worked at Partners in Health, have trained at Partners in Health, and have gone on again to express that sense of partnership and that call to accompaniment in their own work, starting their own organizations, working for their own communities and their own governments. I cannot tell you how many times I have met people who have spoken, yes, of Paul, but also, and sometimes only, of what Ophelia's leadership and guidance and mentorship has meant to them. How often they think of what would Ophelia do? How would she solve this problem? Who would she think to ask for help in solving this problem? Because Ophelia has the unique combination of confidence and humility that I think is quite rare, but I do think we see more often in very exceptional women leaders than candidly we see in men. The confidence to know that her calling and her purpose is exactly what she was set on this earth to do, and yet the humility to know that she's only able best to manifest that when she finds the people that she needs to be in partnership with along the way. Because Partners in Health is certainly not kind of the rhetorical framing of Ophelia's life. It is the moral imperative of how she has constructed her life and her work, and I think is seen so powerfully, not only in the patient served, but in all of the people who continue to be so inspired by her example, inspired by her mentorship, her teaching, her organizational abilities, her operational acuity, her strategic, visionary uniqueness, and her unwillingness to ever give up. And so what would Ophelia do is a question that I ask myself, and I hope that more of you ask yourselves after today, after you learn more kind of through the panel and the conversation with John about this extraordinary woman who is a leader and a gift, partly because she never stops leading and never stops questioning actually what should Ophelia do, and where should Partners in Health be next, and what work must be done to honor Paul's legacy, of course, but always, first and foremost, to serve more people in more places to prove what's possible for all of us. And so while I'm so happy to be here to provide testimony, I'm even more happy to be here to engage in something that my grandmother taught me is the discipline of gratitude, and to say thank you. So thank you, Ophelia, for teaching us about what is possible with enough will and grit and determination and love. Thank you for fighting for the health and the rights and the dignity of the poor. Thank you for your commitment to teaching, to training, to research, to collaboration, to mentorship, to community building, to believing that the partnership in Partners in Health does not stop with PIH alone. In fact, that is always just the beginning. Thank you for making space and place for others to lead at PIH and elsewhere. That too is rare for a leader and an example to all of us. Thank you for taking on the complicated problems. Thank you for leading through your grief. Thank you for not looking away. Thank you for proving what is possible, again, to all of us every day. And thank you again to your family for sharing you with all of us. Ophelia, it is my deep honor to be able to say congratulations and thank you for accepting the 2023 Radcliffe Medal and for knowing that this will only inspire you to do more, which in turn will inspire and instruct the rest of us. Thank you very much, my friend.
Thank you so much to Chelsea for that moving and thoughtful reflection on Ophelia's leadership and impact. And now it's my pleasure to kick off our panel discussion on the essential role of women leaders in global health. We selected this topic for several reasons. Our honoree, of course, is a highly influential woman leader in global health. She's also a powerful advocate for gender equity, reflecting a commitment that is at the heart of her remarkable impact and that of the organization that she co-founded. This is work that is urgently needed. Women's health and access to health care is hindered by long-standing systemic inequities, including limited decision-making power, educational and employment opportunities, and high rates of gender-based violence. The World Health Organization estimates that in the year 2020, nearly 800 women died every day, 800 women every day, from preventable causes connected to pregnancy and childbirth. Close to 95% of those deaths occurred in low and lower middle income nations, though it's worth noting that here in our country, the maternal mortality rate is higher than in other high income countries, and there are stark racial inequities. And as Ophelia reminds us, quote, "The reason why some women die in childbirth and others don't has nothing to do with biology or culture, and everything to do with apathy." Think of what more could be done in every nation where women risk their lives by growing life. Poor maternal health outcomes are just one example of work that remains to eliminate gender disparities around the world. A 2023 UNICEF report found that over 1 billion adolescent girls and women experienced undernutrition, anemia, and micronutrient deficiencies. Women and girls are also disproportionately impacted by HIV, and this just scratches the surface. In short, gender powerfully shapes lives and health. Yet, even as women face these inequities, nations rely on them to deliver the world's healthcare. Women comprise about 70% of the global health workforce. But when it comes to global health leadership, women are strikingly underrepresented. Men hold roughly 75% of senior leadership roles. Across the ranks, women are also more likely to work in health occupations deemed lower status and therefore lower paid, if they're paid at all. It's against this troubling backdrop that today's distinguished panel will examine the critical role of women leaders in global health and consider how and why we must close the gender gap in global health leadership. The panel will be moderated by my colleague, Jacqueline Bhabha, whose decades of work advancing global human rights and her deep commitment to issues of gender will bring invaluable depth to the discussion. Jacqueline is an expert in issues of transnational health migration, refugee protection, children's rights, and citizenship. She is professor of the practice of health and human rights at the Harvard T.H. Chan School of Public Health, where she also is director of research at the FXB Center for Health and Human Rights. In addition, she is the Jeremiah Jr. Lecturer in Law at Harvard Law School and an adjunct lecturer in public policy at Harvard Kennedy School. Previously, she was a practicing human rights lawyer in London and at the European Court of Human Rights. Jacqueline is also a founder of the ALBA Collective, an international women's NGO that works with rural women and girls in developing countries to enhance financial security and youth rights. Jacqueline will introduce our panelists in just a moment, so let me say how grateful I am to Jacqueline and to our esteemed guests for sharing their expertise and their perspectives with us today. And now please join me in welcoming them to the stage.
Thank you very much, Dean Brown-Nagin, for those generous remarks and for including me in this wonderful Radcliffe Day celebration of the work of Ophelia Dahl. I am going to moderate, I think, a fascinating discussion by 4 global health women leaders on issues of enormous social and political importance for all of us today. In fact, I think it's hard to think of any unifying global event that has affected each and every one of us under the tent and online as much as the global health pandemic has in the past few years. Whether or not we were interested in or focused on global health before the pandemic, today, willy-nilly, we surely must be. We don't need to be persuaded anymore that global health is not only a matter of existential survival, but also of social and economic equity within our immediate neighborhood as much as it is across the globe. As with any global issue, from climate change to the enduring legacy of enslavement to gender injustice, the issue of leadership, whatever exactly we mean by that term, is critical. Leadership determines how the issue is framed, how fiscal and technical priorities are established, how messages are communicated. Leadership affects how competing equities are addressed and how deep-seated norms can or will be transformed. And as with any question of leadership, the composition of the leadership team matters. We just heard Chelsea talk about Ophelia's leadership and the qualities that she brings to that job. So who's on the team matters. Who has the power? Who has a voice? Who's listened to? And conversely, who's ignored or excluded? And so I think for all these reasons, our topic today could not be more salient. I think it's not an exaggeration to say that global health and its leadership is one of the key social and human rights issues of our time. And as we discuss the topic together in the next hour or so, with the help of some of the world's leading experts, I think it might be helpful for me just to make a few very brief comments on some definitional points, just to set a common playing field, so to speak. So first and foremost, I think we all agree with the World Health Organization that health is much more than just the absence of illness, important though that is. So we will consider health as, and I'm quoting from the WHO, the state of complete physical, mental, and social well-being, not merely the absence of infirmity or disease. So for all of us involved in global public health, securing health is much more than just addressing illness. Second, as we explore global health, we need to consider the ongoing impact of past legacies on health and well-being, legacies that include, as we all know, patriarchal norms, and I think our dean just mentioned some of these statistics, but also the legacy of colonization and enslavement, which bears a heavy mark today. Global in this sense, and we hear from one of the global leaders who works in this area, it encompasses the US just as much as it encompasses what we often think of as the global South. So let me just give one statistic, and it's actually giving more detail on the point that Tomiko just made. For every 100,000 births, live births, in 2021 in the United States, maternal deaths affected 23.5 white women and 55.3 black women. Just over double the amount of black maternal deaths. And that is within a general picture where the US does extremely badly. Consider that the comparable figure in the Netherlands is 1.2 maternal deaths per 100,000 live births. So I think there's no clearer example of how global disparities and historical legacies continue to play out. Just two more quick points. Third, we'll explore why women are central to this discussion of global public health. Of course, there's no one-to-one relationship between being a woman and the promotion of an equitable healthcare agenda. I grew up in Britain under Mrs. Thatcher, who we used to refer to with the phrase Maggie Thatcher, the milk snatcher, because she abolished free school milk for children, one of the most devastating attacks on public health that one can imagine. So just being a woman is not enough. And a woman's health agenda is critical to thinking about global health as, and we'll hear more about this, maternal mortality, teenage pregnancy, abortion, and femicide continue to be critical issues. Lastly, we will consider what we actually mean by leadership, and we'll question some of the most visible exemplars by which we're surrounded. So I've asked our four distinguished panelists to focus their brief, roughly 5-minute initial comments on one of these four concepts each: the concept of health, concept of what it is to talk about the global, what we mean by women, and finally, leadership. And I've asked them, if they would like to just leave us with one key takeaway statistic so that we don't get swamped, but that we have something that we remember. So, our panelists will speak in this order. First, we'll hear from Dr. Agnes Binagwaho, known as Dr. Agnes. She's the Vice Chancellor of the University of Global Health Equity, a Rwandan pediatrician who's senior advisor to the Director General of the WHO, and she formerly served as Rwanda's Minister of Health. Second, we'll hear from Abby Maxman, who's the President and CEO of Oxfam America, and a very experienced development leader with decades of work within and outside the UN system. Third, we'll hear from Dr. Natalia Kanem, Executive Director of UNFPA, the UN's Population Fund, and as you'll hear, a passionate advocate, inter alia, of supporting the role and leadership of midwives in the health context. And fourth, we will hear from Reema Nanavaty, a director of SEVA, the Indian Self-Employed Women's Association, which is the largest union of female informal sector workers in the world, a model of grassroots women's leadership and organizing, which has impacted not just India and not just South Asia, but far beyond. So it's my great pleasure now to turn to my colleagues on the panel. And Agnes, if I may ask you to open with some comments about how you think about health.
That's a big question, because for me, health is everything. By profession, by practice, and by life. Because it has allowed me, by contributing to organizing the health sector in my country, to really contribute the best that I could to the development of my country and also my continent. So it's a great entry point for human development, the best, by the way, because to have good health, you need to have good education, you need to have to work on agriculture, to have good nutrition. So you interact with all the other sector. It's the pillar in the middle of everything that concerns human development. And also through the neighbor countries, because you cannot have a paradise here and a hell there. It's not viable. So that means he creates also local, regional, and global collaboration. So we can talk hours.
Thank you very much, Agnes. Can I follow with one question, which is the pandemic in Rwanda? How did it affect you, given the many years you spent building a robust health system? Do you feel that you were prepared? Do you feel that you made good decisions? What are the lessons that you learned? And how did the fact that you were Minister of Health, you a feminist woman leader, how did that impact the way you think your country responded?
So long time I was not a minister. I did a lot of things after. But how the country was prepared, I think we start preparing ourselves since the years 19s. Because when you prepare yourself to respond to a potential Ebola, we never got Ebola, but we were prepared because it spread so fast that you need to be prepared. We never got it, but we were prepared. When you are prepared even before, you remember SARS. When you are prepared to anything, you capitalize on experience so that you improve, and improve. And this is something that the world needs to understand. It's not new. You remember when there was Ebola and there was this big title in the Lancet. Something the world never faced. It's not true. 92, 73, we had Ebola in Africa. So that means it's an occasion to reflect on how we are an amnesic species. We forgot what to do in period of crisis. We have everything in our hands to protect the vulnerable. We know that if we answer to a threat by focus on protecting the vulnerable, everybody will be served. We don't do it. We don't do it. And also, the more countries cultivate individualism, the worse it is for the most vulnerable. So there is a lot. We didn't learn anything, I'm sorry. We just confirm that you are not good.
That's a sobering thought, but thank you for it anyway. Abby, you have spent most of your working life, I think, at the kind of cusp of health and development issues in many different contexts. Help us think through this notion of global. What should we mean by that? And I ask as somebody who was once on a panel with an eminent Harvard colleague who will certainly remain nameless, and when I talked about the global community, he said, "What? What is the global community?" So please tell us how we should think about that.
Thanks, Jackie. Well, I want to pick up where Agnes just landed when you were talking about what have we learned. And thinking about global and local, and I have the privilege of leading Oxfam America, which is part of a global confederation that works in 90 countries around the world. And we've explicitly centered inequality in our mission and our vision of what the world could and should be, because we see it as a fundamental precondition to ending poverty and inequality and injustice. And thinking about what we've learned globally and locally, because we think about what happens here happens everywhere. I want to take us to a place every one of us has been. It was living during the pandemic. It's something that touched every one of us. And you all might remember that there was talk or a mantra during the pandemic that no one is safe until everyone's safe. And I think that was an aspiration. It was the right thing. I think it's what those of us who work globally and locally believe. And yet here we are today, and Jackie, I might violate your rule about statistics here, in quotes, but here we are, 3 years plus out, and we looked at the issues of vaccine equity. And today, when we were talking about no one is safe till everyone is safe, and working to mobilize movements and world leaders to make decisions that would make this incredible thing of a vaccine available to all, it's now today 75% of people in the global north, the so-called global north, and 25% of people in the global south have had access to those vaccines. So did we learn, Agnes, to your point? No. Did we say the right things? Yes. Were there movements and actions and efforts with the attempt to do so? Sure. But we can look at where we are versus what our aspirations were. So there's so much to learn, so much to do, so much knowledge and experience, and I want to tie that into how we talk about women and leadership, because also another learning during the pandemic, which is still with us in some ways, is that women are leading everywhere, every day, and we know that. Who is at the center of what's happening at home care? Who has been disproportionately doing the unpaid, underpaid roles that have kept people healthy and safe to the extent possible within their means and resources? And we also see the disproportionate impact of inequity about who was getting sick more, because the people at the front lines were often the women who 92% of women in the America's healthcare system were those infected with the virus and suffering from long COVID today. So those are the kind of things we're grappling with. But again, there's the inequality between global north and global south, but then right here in the United States, as we've talked about already today. So these are issues of our times. We have to listen to whose voices are we hearing and why, whose voices are we not hearing and why. And before I pass to my esteemed colleague, I'll go take us a little bit further back to East Africa, Agnes's work, but I was in Somaliland and Ethiopia recently, and I met a woman, and I would like to have her here with us, named Safia Ahmed. She is a pastoralist, mother of 8, 38 years old, and when I met her, she was in a displaced persons camp, because we looked at the confluence of COVID, climate, conflict, of what's happening and affecting people's lives, global health, and livelihoods every day. And she had just, after 4 years of withstanding 4 years of consecutive drought, a consequence of climate change, an issue that she did nothing to cause and is bearing the greatest brunt of, finally, she told me what made the decision to move to a displaced persons camp after surviving 4 years of consecutive drought, losing 90% of her livestock, her ancestral livelihood that had been with her and her family for generations, was she was finally being circled by hyenas at night. In the 21st century, this is happening under our global work, our global watch. And this is because of some systemic failures. The resources are not being moved to the places where they need. We know that less than 0.2% of resources are going to women's rights organizations in the Global South to help people address their needs in real time. So these are some of the issues that we're grappling with. And I think something that I've known, and I suspect I share with all of my colleagues here on the panel, is things we know that are both proven through evidence, anecdotal, science, et cetera. When women have voice and choice over decisions, that are made at the household level, over their bodies, over decisions that affect the health of their families, that families and communities are healthier and wealthier.
Thank you so much, Abby. So, Abby, can I just follow up with a small question on the very unforgettable statistic you just gave us about the vaccine maldistribution. So that really, to me, illustrates your point about structural factors. This is not that there's more vaccine denial or refusal in some parts of the world. It's not to do with that. It's to do with who controls valuable resources, and presumably who has a burden of debt and who has unfair trade systems. So how does an organization like Oxfam kind of grapple with something of this magnitude, which is, you know, really the world's economy is based on structures of inequality which we've had around for so long? How do you think about that? Just like, what are the main points that you would suggest that we bear in mind?
Well, thank you for that, because it touches on, we help people where they are, working with our partners at their time of need, but we're also committed to working on these structural issues. Throw one more statistic. In 2021, low-income countries had to spend 27.5% of their budgets on debt repayment, which outstripped the combined amounts of resource they could spend on health care, health systems, education, and social services. So to your point, we at Oxfam are looking at these structural issues, looking at the places and systems that are actually perpetuating and disabling those the financial flows that are keeping people trapped and unable to deal with the big issues of our time, be they COVID, climate, and conflict.
Thank you. That's so important. Natalia, thank you also so much for being here. So I made the slightly facetious comment about Maggie Thatcher, but I really do believe that sometimes we forget that what we are really talking about is a type of feminist leadership, not just biological women's leadership. So you've thought about this so much in your own life and your work. So what would you say is the right way to construe the women in the title of our panel today?
Well, thanks so much, Jackie. I'd also like to thank Dean Tomiko. We're so proud of her. As a class of 76 Radcliffe alum, I'm delighted that so much of my class is here supporting me. And of course, for Jessica Vickland and Becky Wasserman and all of you, thank you so much for honoring Ophelia. Ophelia and Lisa, it's a thrill to be here in your honor today. Look, women are half the world. Women have rights, they have choices, and they actually have voices if anyone is listening. So when it comes to the harsh reality that right now somewhere there is a woman who is walking, and she's going to walk for 3 or 4 hours to get to the clinic, and when she arrives, she's going to be told, if the nurse or midwife is there, bring your husband if you want contraception. Is her body her own? Hashtag body right. Elsewhere, and in too many places, a woman is going to get there and be told that the pain is all in your head. We've already understood that the global actually starts at home. So right here, the maternal mortality statistics, the regular mortality statistics, the mental health statistics tell you that young women, adolescents, women of color, indigenous, Black women, are being underserved in a system where they should lead. Now, ultimately, yes, gender inequality, bias, and discrimination permeates health like it does everything else. But what's striking about our health sector is that over 70% of a health workforce is female. And who is the administrator? Who is the head of the hospital? Who is the leader? Only 25% of women in the health workforce hold senior roles. In other words, we're busy delivering global health, and men are busy leading it. And it's this type of power imbalance that can turn a deaf ear to the plight of the woman who is walking. If you have biases and discrimination that come out of this gender factor, racial factor, so many other things, being rural, when women occupy leadership positions in the health workforce, the system actually changes, and respect is accorded to issues that are important to women. In a couple of days, on May 28th, we're going to celebrate Menstruation Day, precisely to shatter the taboos that keep girls a quarter of their school life can be abruptly changed if they don't have a menstrual pad, and that is something that it is within our hands to do. I'd also like to stress that women as consumers are also affected because fertility, which of course should be a joyful, pleasurable result of human sexuality, is too often penalized on the job and also in the home. Of the 120 million unintended pregnancies that occur in this world every year, nearly half are, of the 120 million pregnancies, half are unintended. And in addition, 500,000 of those births are taking place among children aged 10 to 14 years old. So you have to tell me that a 10-year-old can consent. And yes, I read the news headlines overnight, where a doctor is being criminalized and hounded for performing an abortion on a 10-year-old girl right here in this country. Now, until very recently, UNFPA, which is the United Nations Sexual and Reproductive Health Agency, we didn't even measure pregnancies and outcomes in girls this young. So to see the prevalence really hits home. And my final point is that when it comes to contraception, the economic benefits have been documented. The empowerment benefits to women have been documented. Yet it's still a huge challenge for us to deliver contraception to over 250 million women as a consortium of reproductive health workforce all over the world. So when we think about priorities and what makes, quote unquote, the modern woman able to think of being a scientist, wanting to lead in whatever sector, it turns out that the empowerment of being able to choose the size of your family and the spacing of your children is still evergreen. So my hope is that for young people, the example of an Ophelia Dahl, who leads, yes, with conviction, who understands that imagination is what's going to liberate us from the traps that we're in, and who also has that heart, that compassion, that love that we heard about, to be able to aspire to change the world. This is the hope for peace. This is the hope for changing what prevails today.
Thank you so much, Natalia. What you said was so meaningful, but also so sad to think that we still live in a world where the number of 10 to 14-year-olds becoming pregnant is not going down, but going up. It's scary to think of that. I wondered if you could say, how does the UNFPA kind of address this in countries where there are very strong norms still about permitting child marriage, where there are very strong patriarchal assumptions about who decides who a young girl will spend her time with. How do you, as, UN actors, avoid being, imperialistic and swanning in and telling people what to do, but avoid also being complicit in these kind of gross human rights violations? How do you deal with this?
Well, for the United Nations and UNFPA in particular, we have a commitment to end child marriage, working very closely with UNICEF. UNFPA also aims to end female genital mutilation. Sitting here with Dr. Agnes, the fact is, for UNFPA working in 130 countries around the world, developing countries, we work hand in hand with governments. When Dr. Agnes was the minister in her country or any other country today, the NGOs and civil society in that country today, the humanitarian workers. UNFPA is about 54 years old. We were there before, during, and after issues. And I'm very proud of the fact that even with COVID and all the setbacks, something like female genital mutilation, which has no medical reason, socially driven, is changing dramatically in places like Kenya and Uganda. And while the United Nations is a facilitator, it is really women on the ground who make up their minds to, if it's a male system with the chief, bring the chief in. Right now, I'm very, very aware that a lot of these practices are related to wanting to marry your daughter, have her be respected in society. So the human rights of the girl can be abrogated by parental, well-meaning concern, but she still has her own body. She still has rights. So these are the types of conversations at the grassroots that make a huge difference. It's not a superficial thing to move people's mindset, but clearly it can be done and it's being done.
Thank you so much. Reema Ben, it is my real pleasure to invite you to speak next as the only member of this panel who I've actually had the pleasure of working with as a leader for years. So I'm so glad that you are here today. I still remember the founder of SEVA, the Self-Employed Women's Association, the beloved and late Ila Bhatt, who is the former Radcliffe medalist herself, telling me when I asked her how she thought of leadership, saying, Jackie Ben, a leader is someone who creates other leaders, and that's what we do in SEVA. So you've had decades of doing that. Tell us how you think about leadership.
Thank you so much, Jacqueline, and thank you, Tomiko, for inviting all the way from India to speak here on behalf of 2.5 million women workers, and that's why I'm here. As Natalia was saying, if their voices are heard, and I'm sure the voices would be heard here, and therefore I've traveled all the way. And Jacqueline, you rightly said, what is leadership? Who is a leader? And as a union, and as a collective or a cooperative, we have to constantly face this question. And first and foremost is that all women are leaders. That's what we believe at SEVA, and leaders of their lives, of their families' lives, and of our economy. That is what we have found at SEVA. And women, as leaders, do not lead and pull people behind, as we see what happens where leadership otherwise is. But they help other women lead, as you were rightly saying, lead their own life and family and the nation. And they lead by giving and by caring, lead by consensus and patience, lead by creating a nurturing environment for others. That's what we have found at SEVA. And therefore, a true leader for our women workers in the informal sector is the one who puts others in the front, let them lead. And she's with them so that they all feel a collective strength. And therefore, our members themselves have identified criteria for who do you call or who can be a leader. One who is selfless and addresses the issues of all and not her alone, sees the interest in the common interest. One who is willing to give time for others, not for herself. One who is fearless because she's sure about her motives. She's doing it for other members and not for herself. Committed to the cause and dedicated to the path. It's a journey, a long journey. And one who is not greedy but finds more in less. Let me share some examples because everybody may be feeling that these are wise, things to say, but how do you demonstrate that or in your work? And our 5 decades of experience of building leadership has shown that how leaders emerge naturally based on their work. The collectiveness of the organization generates tremendous power and strength for its members in their individual life, and so we call them as born leaders. And since we were all discussing pandemic, during the pandemic with the sudden lockdown, which was a very new kind of a phenomena for a lot of women workers in the informal sector, women realized that, in order to safeguard their families, our members, there was a need for regular supply of water in every slum and in the villages. We were all told that keep washing hands, but where is the water to wash those hands? And so therefore having regular water supply was the most critical thing. And so the cadre of trained hand pump water technicians at Seva did not wait for any instruction, but on their own went to the district magistrate and got certificate or pass to travel from village to village to ensure that all the hand pumps were functioning in the villages. They went to repair them in spite of strong resistance from their own families, and rightly so, as to they were risking their own families and their lives. The women convinced their families and saying that I'm saving the lives of thousands of women and the communities. If anything happens to me, I will be the first one to stop working. Not only did they repair close to 50,000 hand pumps in those times, but they realized that we are traveling from village to village, and the women and their families would need food as well, ration, and they may need some medicines as well. So they started taking that and delivering it to the households. It is these women leaders who understood and acted as per the needs of their fellow women in the communities, took on the risk, but also the responsibilities, and they were accountable to the members. So I can go on with examples that, also we had to educate and make the communities aware for taking the vaccine, as there were a lot of misinformation about the vaccines. And adopting the mantra of seeing is believing, our grassroots leaders took the vaccines first to create confidence amongst the members and their families. They did so in public, that nothing happened, we didn't die because of taking the vaccine. And this helped the members in believing the effectivity of the vaccine and helped eradicating the misbelief. These very women were then asked by the government to run the entire, vaccination campaign. So I think what I wanted to say here, therefore, was that without poor women workers and the leaders amongst those poor women workers' involvement, I think we have needlessly made health more corporate rather than cooperative, more cost-driven than it is need-driven of the poor, of the women and the communities. I think more top-down rather than lateral. My examples were just, showing that. And more structured than, flow-driven, more medical than public and community well-being. And that was what I was hearing this morning in the conversation, that we all have to focus on well-being and not on administering medicines. And what was with women in the form of health commons or public health is taken away by and privatized into hospitals. And we find this happening in the lives. And that's why what Natalia was saying is the fate of women today. And I think in our experience, it was confirmed during COVID-19 response and recovery that if health has to be a universal good, available to all who need it, it is the women, their collectives, under their leadership, they will have to be in the front line. And this is what, when women as leaders, they turn the health economics into an economy of nurturance. And this is what I think we all need to really work on. We also need women to lead the audit of health measures, and because it is so interconnected. And our founder, Ela Bhatt, called it as Anuban, the interconnectedness of health, of their lives, the well-being. And similarly, I think when at Seva, women are leaders and they are more prone to see the common good, the collective good, and opportunity to cooperate. And lastly, I would like to say that, women are as leaders in the community, and I'm talking about women from the women workers. I think what we experience is that we do not have to wait. If we go on waiting, there is a saying that poor can always wait, but if we want to really work on our well-being, then I think the most important, and I'm sure you all would recognize when I say what our members say, and they say it by singing, is Ame par karishu, Ame par karishu, Ame par karishu ek din. We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in our hearts, we do believe we shall overcome someday. As women, as leaders.
Thank you so much, Reema Ben. That was a wonderful set of comments. So I would like to follow up with your comments with something I remember from my very first trip to Radhanpur in rural Gujarat with you, which was you showed me these very simple latrines that that Seva had built, and I didn't quite understand the significance. And I think you explained how for so many women, so many of your members, really having safe and hygienic sanitation was a huge struggle. And so just as you said, instead of waiting, you decided to, I presume, I would love to hear a little bit more, but you decided to hire some experts to build really, really cheap concrete latrines that any home-based worker could afford. So just tell us a bit about that, because that seems to me such a fantastic example of collective and not corporate healthcare.
Thank you. And as Natalia was saying, that 28th of May is the menstruation day, and you provide latrines. But if there's no water, you are adding to my burden of again collecting water, head loading it over miles and miles together. And second is when we speak to the women, for them having a safe place for bathing is equally important. And together with having a latrine. So we had to figure out that how can you design a twin unit where women can bathe, wash their clothes, and also have a toilet, but at the same time do not have to head load more and more water for the families, because she may be the last to use the latrine, but the men in the household would use the latrine first, and so she has to head load more water. And so we worked out a design where you have a rainwater harvesting structure, so you harvest all the rainwater when it is available, so she doesn't have to head load it over miles, but she can have it near her home. And then you have a twin unit of a bath and a toilet. And when we designed such a structure, but at the same time we had to see the affordability of the women, I think we didn't need any campaign. It just went on and on and on. And today, 500,000 women in their houses have a rainwater harvesting structure. They have a bathing unit. They have a toilet. And this is what climate action means, that you are addressing the issue of climate and health. We don't need campaigns or we don't need subsidies to do that. It's just you understand the needs and then make it affordable. And then we had the sons and the daughters who themselves became masons. They were trained, and so now, they themselves are taking it forward.
Thank you. Thank you. That's that wonderful example. So I wonder if I could now open it up to all of you. I think Reema Ben has just given us, and I should just explain that I call Reema Ben, because in Seva, everybody is a Ben, everybody's a sister. Sister Ben is sister in Hindi or in Gujarati, and so everybody is called by their first name and is referred to as a sister, which I think is wonderful. But you just gave us this example of really a wonderful success story. So I wondered if all of you could reflect from your experience, things you've been involved in the kind of spirit of women leaders in global health, of successes, because this field, unfortunately, is full of really grim facts and statistics and developments. So I would like us to think about takeaways, for those of us who work in this field, that we can learn from you, of things that you think have been successes. Maybe, Agnes, we can start with you, with one or two examples from your work, either work in the field. You were telling me that you were a neonatologist because of the, mother-to-child transmission of HIV/AIDS initially. But any examples, either from the field or from your role as now a senior leader, that you think would be interesting for us to hear about?
I think that the community health workers is one of the best examples. Many countries started with men because, you have to go across the village to another village, etc. And early 2000, we start to involve women as well. And this changed everything. And also make the community health workers elected by the village, meaning they chose who. Sometimes the person say, no, I can't, but at least they go to the second choice, etc. So even if I don't vote for you, because my community voted for you, you can enter in my house and I trust you. And then when you have a pool of people like that, because there are conditions, you need to know how to write, you need to read, you need to be able to do a report, you need to be above 18, etc. But when you are there, then the ministry has to educate you how to overcome 80% of the burden of disease of a country. When you don't have a lot of nurses and doctors, can you imagine what capital of health you are building doing that? With the trust of the communities. Because COVID has taught us another thing. It's not a matter of money to trust your government, your security, your judiciary system. It's a matter of trust. And when you don't trust the leadership system, you don't trust the science. And when you don't trust the science, you fight vaccine. And you fight the etc. So all this is implicated. And if I can advise something, teach that at school. In nursing school, in medical school, in sociopolitical schools, socioeconomic schools, because this makes the difference. I'm so shocked, that there were more than 1 million deaths due to COVID in the rich countries. If there were 20,000 deaths due to my incompetence, I will be under trial in judgment. Where are the responsible of that? They go free? It's a scandal. So I think we have a responsibility. You take a position, don't take the seat only. Take the responsibility that go with it and be accountable. Those deaths are deaths due to lack of accountability. And be careful, it's not the last pandemic. So, if measures are not taken, another million of people will die tomorrow due to another virus or another bacteria that people who should not die. We have responsibilities here.
Thank you, Agnes. Thank you for both highlighting really the theme. I think one of the strong themes that coming out of our panel is the importance of the grassroots, of community-based development of approach to health, to well-being that is kind of diffused within the society, but then also the sense of being decisive and having an ethical leadership. So thank you so much. Abby.
Yeah, building on that, I think there's the local and the global and the national, and there's so many examples, and I think the examples of success are the ones that don't get spoken about so much, because what is prevented in terms of crisis, catastrophe, or loss isn't what is measurable or in the news. For us at Oxfam, I'd say at the local level to global, there's so many cases and examples of change across Ethiopia, Mozambique, Zambia, and Malawi. We have a program that's called Her Future, Her Choice, focusing on sexual and reproductive rights, giving young women and adolescents voice and choice, information, basic access to information that they might not have, to take control of their lives, their livelihoods, their reproductive rights. And so examples like that are proliferating in many places. To your point, Natalia, about the great progress in ending or reducing female genital mutilation, access to clean water, all of these things that don't get counted every day. But at the same time, there's incredible investment, I think, and we're seeing progress in anticipatory action. When we invest, when we see signs of stress in communities and vulnerabilities, and we actually take the early action, how do we prevent, us from getting to the point where the F word, famine, comes into play? And when that's prevented, that's a huge success. We're actually at the brink in a difficult situation across East Africa at the moment because the systems aren't working as well, but we also see it working well in places like the Philippines and elsewhere. The preparedness, the response, the prevention, and systems are really working well. And maybe I'd say one more thing is looking at how we are working to hold those in the private sector accountable for their actions and what they can do, be it campaigning with pharma and looking at their responsibilities as it relates to vaccine access and vaccine equity, something we do. We do a lot of shareholder advocacy to make sure we are bringing the voice of those who are not at the table to the table on these issues that we've seen both some failures or things that we don't think are good enough and successes, but also looking at how some of the big global companies, the largest 10 food and beverage companies, are behaving and taking action to uphold and improve their commitments around gender, around land rights, and around climate. So this combination of local to global, what's happening at the local level day by day, the things that Reema was talking about, there's thousands, countless numbers of work and partnerships going on. We work with over 3,000 partners globally, and it's really a remarkable testament. And how do we celebrate and showcase those more so that those be the examples of the approaches that are working?
Thank you. Yes, that makes so much sense. Natalia, I wanted to ask you, we've talked about female genital mutilation or female circumcision. It's one aspect of violence, you could say. But we know that there's so many other aspects of violence against girls and women, including what people, especially in Latin America, refer to as femicide, as being an epidemic. How do you think we should think about this in terms of, the work that we do in these communities? Because, of course, these behaviors of violence do reflect norms which are very hard to shift. And that's the thing that I think some of us are most concerned about. These are these are not just acts of erratic folly. These come from deep-seated understandings of who has power and who can speak and who can control. So how do you think about that? And are there any success stories that you can share with us in terms of really shifting the needle on violence against girls and women?
Well, absolutely, Jackie, Ben. I must say that violence against women is pervasive everywhere. There are expressions that may be shocking to you. However, as in the case of female genital mutilation, tradition and culture plays its role, just as it does here in Boston, where tradition and culture sees girls harassed online, right now, not knowing what to do, retreating, and the mental health consequences being huge. Gender-based violence is a term that really disguises human shocks that are indescribable. And all of us sitting here at the podium understand that when there is crisis, flood, famine, war, it's heartbreaking. I think the humanitarian work that UNFPA does is the hardest for me, because you realize that anyone can be affected at any time. Crossing the border from Ukraine into Moldova, working with women who don't want their husbands to know what happened to them on the road. You, again, go back to the basics. Sexual and reproductive health makes women particularly vulnerable because it's a point of intimacy. It's a point of violation of the physical body, but it's also very much a violation of someone's psyche, their psychology. The good examples that we see are, first and foremost, when men stand up and take their role in rejecting patriarchal power. So, very dear to my heart are the traditional chiefs of Niger, the chef traditionnel, who are on the record as supporting women's right to space their children and families, but also protecting schoolgirls from the potential of violence on the way to collect the water or whatever they have to do before they actually get to school. I will also say that midwives are part of the hero of any story when you talk about public health. Earlier, Jackie reminded us that there's great disparity in terms of who dies during pregnancy and childbirth, and the difference between the countries at the bottom of the maternal health list, primarily today, Africa, plus Myanmar and Afghanistan. And the Netherlands, which you showed, there's a 20-fold difference. Often it's because of a tradition of midwives who know the community, akin to the community health worker that Dr. Agnes was talking about. And in June, when I addressed the World Midwives at their Congress, they meet every 3 years, I am going to commit to help them to double the number of midwives in the world from the current 900 to 2 million. And that's going to make a difference because by our own estimates at the United Nations, if we close the deficit in the number of midwives, if we can double the training that we're doing and the outreach that we're doing, we can actually prevent 2/3 of maternal deaths and 2/3 of newborn deaths. And I'll also say that for me, part of the success on the violence issue is #MeToo, #MyBodyIsMyOwn. The concept of international solidarity and the sea of pink hats across the world from Sydney to Nairobi to this country, it makes a difference when women work in concert. And it's not just in the union of Sewa, which is amazing if you ever get a chance to read about what they're doing. But it's each of us as that little grain of sand who cares, who makes a difference. And again, I think that's why we all jumped on the plane to honor Ophelia. It's not because anybody is going to give you a medal. It's because you care and you use everything within your power to arrange your part of the world to make that difference. So it's really a wonderful thing, and it does add up. Thank you.
Thank you. Reema, Ben, you already have given us some wonderful examples. I wonder if you could share another example of the way in which Sewa creates leaders from every single member of the community, which is again something that struck me, which is the circle and people introducing their name. Can you explain why that's important? Why is it important for every single woman? I presume the majority are illiterate and have never been to school. Why is it important for everybody to, in any meeting, not only sit together, share food across castes, but also say their name?
I'm so glad you asked that, because I was fearing whether what is Sewa, I should really talk about it or not, because we are here to talk about health and global health and everything. But I think what you were just saying is that we at Sewa come together as poor, as women, and as workers, no matter what caste, community, or religion we belong to. And I think we come together to build our collective strength in order to fight poverty. We are not here to fight a government or a contractor or an employer, but our larger goal is that how do we come together as poor, as women, and as workers to fight poverty? How do you address and overcome the vulnerabilities that we have been discussing? Why does all this happen? Because a woman is poor and she's vulnerable. She's so worried that tomorrow, will I be able to find work or not? Will I be able to feed my family or not? And therefore, she is, subject to violence. She's subject to abuse. And therefore, I think, to feel that we are all sisters, we all come together, we sit always in a circle so that everybody is equal. We sit on the floor so that women feel comfortable, and we are again all equals. We start with an all-religion prayer because our lives are full of struggles. How can we, leave behind those struggles and come together to think of something afresh? And very important is that poor, for them, innovation is their coping strategy. And it's not a luxury. And I think that is what is very often forgotten. And so how do we come together to learn about those innovations? How can I learn and then take it forward? And I think one of the things that came out from the COVID-19 was that, I was talking about the vaccination thing. When everybody's vaccinated, what do the leaders do? And they immediately took up to, using the glucometers and the blood pressure instruments and everything. And now they do tracking and monitoring of NCDs. Nobody had to teach them, They realized that, oh, wow, the women are now suffering from something which is called blood pressure, or something which has resulted into sugar or cholesterol, which was again something new for them. But how do you start tracking and monitoring it? And when you start feeling better, you discontinue taking the medicine. It is these women as health workers, they are going back to them and taking them and referring them to the primary health centers. So I think that is why I think, community, the sense of ownership, the sense of belongingness, which is so important, that they don't wait for a program. that if there is a program, then I can do this or I can do that. But it's my community, my sisters, and therefore I have to be with them whenever I'm needed. And that is what makes Seva what Seva is. Our membership keeps growing, and therefore we are also very often seen as a threat. Because, you know, the membership of the poor, of the women, keep growing. We grow by almost 20% every year. So, yeah, thank you.
Thank you. So we don't have a whole lot of time. I wonder, does anybody want to add something or ask a question to our fellow panelists or offer a comment that I haven't kind of already given you an opportunity to share?
I'm going to give a comment because I'm very talkative. So, first of all, I'm so pleased to have traveled. It was not easy because I come from all over the world to honor Ophelia. I cannot dissociate Ophelia from Paul Farmer because I knew both together. They worked both together to support my country development of the health sector, and also by building partner in health and exporting all those great ideas, because she learned by doing, though, even Paul, even us, everybody. And exporting success elsewhere to accelerate access to quality health service to the vulnerable. So it's a great honor to have traveled to honor you, Ophelia. And the luta continua.
Well, building on Agnes, it's a wonderful thing to be honoring Ophelia and thinking about a movement of social change and social justice and what we can imagine together, building on the legacy that Ophelia and so many others who are not here have built over decades. And really, I would like to co-opt a bit of Reema's point about an economy of nurturers. At Oxfam, we talk about reimagining a post-neoliberal economy, something where the dignity and rights of everyone is considered, that we don't have to be shackled by the system that is actually highly unequal, that is keeping women and marginalized communities trapped in poverty, and imagining a more equal future with a new kind of leadership. But I almost wouldn't call it new, an economy of nurturers, because, as you said, Natalia, 50% of the world is made up of an economy of nurturers. And how do we make that an example of what 21st century leadership is?
Thank you. Yeah, absolutely.
Well, I'd like to say that next year and the year after, 2024 and 2025, we'll have a pair of 30-year anniversaries. Next year, the Cairo Conference on ICPD, which asserted that sexual and reproductive health are rights, and the year following, of course, women's rights being human rights, as famously said by Hillary Rodham Clinton. For these anniversaries, the bodies of women should not be controversial. They should not be used to divide the member states of the United Nations into positions which put women at huge disadvantage and cost lives. I will add that the discussions about the rights of all of us, including lesbian, gay, queer, transgender, and intersex individuals, should also not be used as policy wedges. Instead, what we need to do is to defend rights and choices for each and every one. My last point is that, thank you, because I'm adamant about this, thank you, is that Ophelia, as you've heard, began her reproductive, well, for me, reproductive health, her health work in Haiti, and we've renewed our commitment to that country, which has suffered everything by way of natural and social disasters. Thank you so much.
Reema, would you like to have the last word?
I just had 3 points, will be very, very brief, and I would just like to say that being a mother of 2 sons and a husband who has been very, very supportive, I do want to say that men are not bad, but it's a matter of what kind of an exposure you are giving to your sons. I used to take my boys from the age of 7 days so that they don't feel that, oh, my mother is having a gala time, moving around 8 single day. Or, your son asking that, when his father was moving around in the disaster-affected areas, oh, the daddy has come to stay with us now when he was home for 7 days. So I think that is what the lesson I've learned from my own experience. And 2 other things, I think, which is that when we talk about health security of women and, how they are able to cope with it, it goes hand in hand with economic security. Unless and until women are economically secured, they are not able to deal with their other vulnerabilities. So that's my second learning. And my last is that I hope when we celebrate our 100 years of Seva, a Radcliffe Day where a lot of informal sector women workers would also be here, attending the Radcliffe Day event, and that's what we hope someday would happen. Thank you.
So thank you all so much. I really want to commend my Radcliffe colleagues for putting together this terrific panel. I think we've covered a lot of ground, deeply and wisely, if I may say so, really emphasizing the importance of different dimensions of women's leadership in global health, but homing in on the fact of nurture, non-selfishness, and the real importance of grassroots organizing. So, Tomiko, thank you for giving me this opportunity to be here. To be here and to be part of this conversation, and congratulations to our medalists, and thank you all for listening.
And I would like to thank Jacqueline and all of our panelists for such a thoughtful and engaging discussion. And I also want to announce that we'll take a break for lunch and then reconvene at 12:15 for our afternoon discussion of Ophelia's work. Thank you.